Welcome to the Smiles Are Wild show, brought to you by Pediatric Dental Associates and Orthodontics. We know as parents that taking care of your children's teeth can be overwhelming. That's why every week we will bring you educational content to encourage and empower you. Thanks for joining us. Hi, good morning, everyone. I am Amy Morgan. I'm the marketing coordinator here for Pediatric Dental Associates and Orthodontics, and we are so grateful for you joining us this morning. If you're watching this video now, please let us know where you're watching us from. You can just type that right down there in the comments. If you're watching the replay, please use hashtag replay to let us know that you went back and watched it. You can also tell us where you're watching the replay from. We wouldn't mind about that. Just a couple of reminders here at the very beginning. We want to make sure that you are following us on our social media channels. You can find us here on Facebook as well as Instagram by searching Smiles Are Wild. And then we also have a YouTube channel that not a lot of people know about. I try to promote it every week, but what we would really like is for you to go over to YouTube, search our office name, Pediatric Dental Associates and Orthodontics. Yes, that's a mouthful, and we're trying to get it fixed. And you can help us with that fix by subscribing to our channel. Okay, the more subscribers we get, the more we have ability to control what you have to search for to find us. So right now, go to YouTube, search Pediatric Dental Associates and Orthodontics. Go ahead and click the subscribe button, and we promise that in a few months, hopefully it'll be easier to find us if you subscribe. So we're counting on you. All right, so now that all the business stuff is out of the way, today we are going to be talking about what it is like to be an adult in orthodontics at a pediatric dental office. So a little bit of history here. Dr. Jason does orthodontics for children, teens, and adults. And we've really tried to continue to provide that service to adults, especially parents of children within our practice, because we're trying to make things as easy as possible. We're trying to meet you where you're at. So if you're already coming to the dentist or our office for your kids, then maybe you can loop in some appointments together and things like that. So we do have a very special guest. I'm going to bring him on here on the screen in just a minute, but this is going to be Bryan Fittin. He is an adult ortho patient of Dr. Jason's. He's also a dear friend of our office, and we love his wife. We love his children. They're amazing. Just a wonderful family to really work with, but we knew that Bryan would be able to bring you all the information. Bryan started his Invisalign treatment approximately a year ago. So right in the thick of COVID, we got him all started. I'm going to go ahead and bring him on the screen and let him say hello. Hello, hey. Bryan.
Hi. How's it
Welcome.
going?
Thank you so much for joining us today. We really appreciate this.
Yeah, absolutely. I'm excited.
For sure. Okay, so we're going to get right into it. Just get right into this content. Get right into kind of one of the main things that I have seen I've been with PDAO now for 15 years. And one of the things that I've noticed the most since Dr. Jason joined our practice is that we have adult parents who will maybe mention that they want ortho or they're thinking about it or whatever. But there's always this just like, but I don't know if I want to come to the kids' dentist to do that. And so in creating PDAO, the new building in Fayetteville, we actually designed the ortho area to be more adult friendly. So I know we've kind of talked about it a little bit, but just share with me kind of your initial thought process on, I think I want to do this, and kind of what held you back, or what kind of brought you to this decision that you were going to go ahead and go with it.
Yeah, absolutely. Well, I mean, our kids go there. You mentioned that before. And so I was familiar with, just the process of having them and their appointments and checkups and all that stuff. And so I think for me, it was like, I enjoy things. And so I'm like, man, it'd be awesome. I wish I had this when I was a kid, right? Like that was my mentality. I was like, this would have been great when I was going to the dentist. You guys make it so much fun and it's enjoyable and it's not like a terrifying experience, which for most kids, growing up, that's the way it was. It's like we hated going to the dentist. And so whenever our kids, we got to know you guys, got to know the staff, they were phenomenal with our kids. And so when it was mentioned, it's like, oh yeah, we have orthodontic treatment. I had braces when I was a kid and didn't maintain my retainer, didn't, wear it often enough, and then lost it. And then eventually you just get older and you're like, man, I wish my teeth were straighter. It was one of those things. And so the conversation just kind of came up with Dr. Jason, and he was like, yeah, we do adult orthodontics as well. And so for me, I was like, well, what does that actually look like? Because, I have wanted my smile to be back to where it was before, but as an adult, I'm like, I don't want to go through the whole brackets. I don't want to do all of that stuff again. So what are the other options? And so, Invisalign was presented as well, but this Smile Direct type situation, I was like, I don't feel comfortable with that. And Dr. Jason was like, no, 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 we make sure that we do everything correctly. We make sure to come on and actually do scans of your teeth. We'll make sure to check in on them. And so that made me feel really comfortable that it wasn't just me out there on my own trying to do these, direct to mail type situations. And so, again, I enjoy it because I get to watch, any kind of show I want to as well. If I sit in the chair, or also, have the experience that my kids get, which is a lot of fun too. But it's obviously, I'm not, the treatment of myself when I come in there, they obviously know I'm an adult. And so they treat me a little bit different, but it's still a fun experience. So.
For sure, for sure. I think you hit the nail right on the head too. One thing that I was hoping we would get to, we did not pre-discuss this, and I don't
Right.
know why I didn't think about it, but it's the Smile Direct Club. A lot of people think, that this Smile Direct Club issue is something they want to do for saving time, and it's simple. They don't have to get in front of a dentist and do all those things. But really, like, we highly recommend that you have any kind of clear aligner treatment with an actual orthodontist. And that's
Mm-hmm.
not just because obviously it's a profit for us. Like, we understand that piece of it, and that's, we're going to be clear and transparent about that piece. But really, it's about the fact that you need to be guided by an orthodontist or a dentist who does ortho during the process, because there are so many things that happen when you start shifting all of your teeth. Your
Yeah.
jaw is moving, your bite is different. Like, things can really start to happen. It's not just as simple that your teeth are lining up. I mean, it's literally not that simple. So I'm glad that you really touched on that.
Yeah.
So going back a little bit to what you talked about having braces as a kid, I've seen some very lovely photos of you in braces as a child. Just saying. Yeah, glad you're doing it now.
I've come a long
But
way since then.
let's talk a little bit about that process. So you came in for the consult. Obviously, Miss Tina talked to you about what we're going to be doing, or Kara talked to you about what we're going to be doing. Dr. Jason says, okay, I think we're going to do Invisalign. And now we're going to take scans of your teeth. He
Oh,
didn't
yeah.
say impressions, he said scans of your teeth. So
Yeah.
talk a little bit about what that looked like as a child versus what it looks like now.
Yeah, I think I had mentally prepared ahead of time. I was like, okay, if I'm gonna go through the braces, we're gonna, all of these things, right? And I was like, it's gonna be rough. I hate the goop that you have to put in your mouth, and it tastes like bubble gum. It's like, it doesn't really taste like bubble gum. But it was interesting because it's like, oh, no, no, we don't do any of that stuff. Like, we have this machine that basically we scan your teeth. And actually, I just had an appointment recently that we just did a new scan, and it was 5 minutes, and it actually inputs it. You can see it on the screen. It's like taking photos of your teeth, like a little video, and it puts it in a 3D format. And that was kind of blew my mind when I first did it. I was like, well, that was super easy and super simple. And even if they have to go back, it was just really quick to actually go through and take pictures of my teeth right there while I was in the chair, and it was done. No impressions, no goopy stuff that I had to put in my mouth, nothing like that. And that's a game changer for me as an adult, but I'm sure as a kid going through that, it's just really quick. It's just part of the process that, again, the kids won't have to relive what we went through as in our childhood, because now there's awesome technology like that available, which is really cool that you guys have that.
Yeah, for sure. And I mean, even just, I mean, I can't remember what exact years I was in braces, but I did actually adult braces with Dr. Jason, and I had to do the impressions every time. So when we got the
Mhm.
fancy, we call it's an iTero scanner that does the basically digital scans of your teeth. I was really impressed with it. And I mean, we're even able to do it on like kids. Like, we did a commercial shoot with Grady, and he was like able to just like let Lorena like scan his teeth. It was so easy.
Yep.
And
Yep.
then, so even for young children, and then they're also seeing that also helps with the scans look better, they're more accurate. So then your orthodontic treatment is not prolonged, because maybe there was a little bit of some kind of situation with your impression.
Mhm.
So they thought maybe something was supposed to go here and go there, but it wasn't.
Yeah.
And so just the accuracy has paid off, and also the time of return on those as well, because we are getting an automatic 24-hour turnaround of what your teeth are going to look like and what the process, especially for Invisalign, is going to
Mhm.
look like.
Yeah.
So then, so sounds like that part was pretty good. So now you've got, now you've come in, you've had the consult, you've done the scans, we have your trays, you started in your trays. All that process is kind of explained to you very well, how to keep them clean, all that kind of thing. Talk a little bit about what your in-office experience has been like as far as like the visits that you've had to come in for.
Yeah, I think for mine it was interesting because COVID hit right after that, and so we went to some of the virtual appointments as well, and that was easy to go online book. We did a few even after the fact, right when you guys opened back up. I was still able to say, hey, I'm not able to make it into the office. Can we do a virtual setup? And so Dr. Jason was super accommodating with that too, because again, I think as weird as it is, I feel like I got treated a little bit different being an adult. Like it was kind of like that interaction was actually really nice rather than just kind of being run of the mill type of I guess dentist office where they just kind of run you through. It was like they were taking it seriously whenever I was actually being accommodating with my schedule and stuff like that. And so it was really nice to go through that, as well as the in office experience of checking on everything, making sure, like we talked about before, like making sure the gaps in between my teeth are appropriate, and kind of shaving things down, making sure everything aligns. One thing I didn't mention before, but I have always had kind of just back issues because getting old. And so when we started to fix my bite and things started to line up, I have had less back pain. It is weird. I guess in the middle of nights I've been grinding my teeth or stuff like that. And so it's kind of strange how all of that affects other parts of your body too. And as again, when you get old, it's like all that stuff matters. So I was like, I was just thankful to him. I was like, man, I don't have to go to the chiropractor as much anymore, so just because we're like fixing my teeth. But again, super accommodating with everything that they've been doing there in the office, and making it, again, the virtual appointments, virtual visits as well. The communication through that has made it, again, I'm super busy and with work, and my calendar's always changing. And so it's really been nice to be able to be flexible with that. And everybody at the office has been great with that.
Yeah, I think that's, I mean, you hit exactly what kind of how I feel like we want that to appear. As the marketing coordinator here, I really try to make sure that the patient experience is um, calm and inviting, and then also like super fun for kids and things like that. But when it comes around to the adult side of things, we're really just trying to be, obviously accommodating, efficient, make it
Mhm.
work for your schedule, like that kind of stuff. So it's good to hear that that's actually occurring for
Well,
most of our adult patients. So,
yeah, I'll
next
say,
thing
well, oh, go
go
ahead.
ahead.
I was gonna say, being able, it's not like your standard. Like I think you think in the doctor's office, you're like, I'm gonna sit here, I'm gonna wait for 30 minutes. It's like you guys have done a great job of like, whenever I'm there for my appointment, I check in. It's kind of nice just to hang out in my car and not just have to like sit in all amongst everything, obviously with COVID restrictions and whatnot. But it's been nice to just be able to like hang out. And then when you guys call me back, it's maybe 3 to 5 minutes. I mean, you guys have been consistently quick, and that's not the expectation. When I go to the doctor or dentist, I'm like, I'm gonna sit in the waiting room for 30 minutes. And like for me,
Yeah,
it's been nice to just like you guys have been moving those along really quickly, in and out, and it's been great. So
for sure. And I mean, we really strive to really deliver that VIP experience for the adults. So it's, that's kind of something where with the patients and kids and things like that, you're dealing with a lot of things on the back end with children, as far as like, usually we have to do some updates, and there's some insurance things, and there are obviously cooperation issues with children. So we operate on what we call kids time in
mm,
the pediatric dental department, meaning that if your child is uncooperative and their appointment takes a little bit longer, we're going to work with you. We're going to work with your kid. We're going to
mm,
make sure we're taking the best care of them. But then the opposite side of that is that, that may prolong another appointment. But what we always promise is that if you have a difficult time with your child or something's going on, we're still going to allow that grace, for you as the parent and for the patient to really, get the good effect of seeing the dentist and things like that. And you just don't have that same type of scheduling conflict in the orthodontic department normally, because you're already in the treatment. So those things do go a lot faster. So I'm glad that you touched on that, because I do feel like sometimes parents are seeing kind of what's going on that pediatric side, and they're like, I
yeah,
can't do this for myself all the time. And
yeah,
it's not the same. There's definitely a
yeah,
VIP experience. The The bay in orthodontics, if you haven't ever had a child in the orthodontic department in our office, is really catered to an older environment. There's not like a ton of animals. There's actually only one.
Mm,
It's not all different colors. It's got a really good like color scheme. And so if you're in our office and you want to peek around there, it's in the corner towards the front. And it's also separated. So it's not like you're
yeah.
over in the pediatric side listening to the children not be happy about their
Yeah.
appointment. You're actually in a different bay. So
Yeah.
just want to make sure and point that out. So I'm really glad that you touched on that.
Yeah.
And I think now, just talk as as much as you want to,
Mhm.
kind of about what your at-home experience has been like with the Invisalign. We've made a few jokes about it and things like that, but your actual like, I got delivered my trays, kind of what that
Mhm.
situation looked like, and then your at-home like kind of care routine and things like that, and
Mhm.
how that has gone in with your daily life routine.
Yeah, yeah, absolutely. Well, I think just in general, like my experience at home, like I wear these, roughly about 22 hours out of the day. And so you take them out to eat or, I drink coffee. And so they, you got to be careful about discoloration and whatnot. But other than that, I mean, it's really, I wear them all through the night, get up, we brush them, clean them, put them back in. They've kind of just become part of my life. I've tried to be very diligent about it because, if I don't wear them, it's going to be longer in there. It's not like actually having braces attached, right? You can't do anything about that. Like, as an adult, you do have to be disciplined to make sure that you are wearing them. But other than that, it's interesting. The other day, I was taking him out when we were eating lunch with a friend, and I said, "Oh, hey, excuse me," and so I popped him out, and he was like, "What is that?" I was like, "This is my Invisalign." He's like, "I didn't even know you had those." I said, "Yeah, it's going almost almost a year now, and I see this guy all the time." And it's just kind of funny because it's like the experience of having them has been just like it's again part of my normal everyday life. I have my little case here. Oh, you can see that there, but this is what I throw them in, clean that out too, and have that to where I can just throw it in my pocket. If I'm meeting with somebody or if I need to be able to pull them out quickly, I can. But in general, you get every single week you get a new tray, and so there have been times where it's like I've needed, I get a bulk amount of trays. We do an appointment checkup or something like that, or if we needed to reschedule, they'll just mail those trays to me. You guys have been great about that as well. It's like, hey, doing again the virtual appointments, kind of checking in on stuff. I do the photos myself, on my own phone and be able to send those to Dr. Jason. He can look at them. It's been honestly just super easy. It's just part of again, it's part of that routine that you get into. But I would choose this myself. I didn't want to go back in the standard braces, and so with this, I try to be diligent about making sure that I'm consistently wearing them and training them. And honestly, it feels weird when they're not in, which I think is funny. So it hasn't changed my life so much. It's like, oh, this is a nuisance. It's just been part of it, and you just get used to it. And it makes me drink a lot more water too. So I have to keep that going. So a little healthier there.
Sure, the health benefits of Invisalign is a whole other talk that we could do, right? It's like,
Exactly.
yeah, all the
Exactly.
things. So, again, we obviously value you as a patient. We value your family as patients, and like we really appreciate you giving your time today.
Yeah.
Is there anything else you want to share? Do you have anything else that we didn't hit on? Like, I'm totally fine if you just have anything else you want to say about it.
Yeah.
Anything?
Yeah.
Dr.
No,
Jason is
he
amazing.
is.
Kara is awesome.
It's funny, as weird as yeah, especially the staff, in Fayetteville. You guys have done phenomenal, and that's just even with Kara. It's like she'll call me if we need to make adjustments or something or change around stuff. I feel like it doesn't feel like, hey, I'm calling the front desk, and even the ladies at the front desk, have gotten to know me too, and so that's again, it feels a little different, a special experience, because you guys don't see a ton of adults, and so I think it's nice for them to just be able to like, hey, I need to update. They're like, oh, it's for you. Oh, okay, cool. But just even, walking in, we talked about, where I have sat before. I mean, you guys have that even a little room off to the side. And so I know that when I first started coming to, we just kind of did like, oh, it's that little private room over there, which was really nice too. It made me feel comfortable. They just kind of, Dr. Jason just kind of judged, and really walked that path with me. And kind of my customer journey through this has been great. And he always, anytime he sees me around the office or something, hey, how's it going? Like, even if I'm not there to specifically see him, he's been so great, and just open to any questions that I have. It's been, been fun, but now it is kind of fun to kind of get out in the bullpen area and hang out with the other teenagers or whatever. It's like, hey man,
Right.
how's it going? And so it's
Yeah.
just, again, it's been a fun experience. So I've really
That's
enjoyed it.
awesome. That's awesome. Dr. Jason is a phenomenal orthodontist, and I do
Yeah.
not just say that because I work for him. Like literally the magic I have seen him make happen is, and he's a total
Oh yeah.
perfectionist, which most orthodontists are, but I feel like Dr. Jason takes that like just
Hmm.
another notch up. So like I really, he's just a phenomenal person as well. So I'm
Well,
I'm glad that you've had a good experience.
I'll tell you too. I mean, going into it, like I don't have perfect teeth, and so for him to care more, even more than I care about my teeth, was a very different. It was like, oh, I should really think about these things. Like he strove for that perfection up there too as well, and so I appreciated that because I have a few crowns and stuff and too, and I'm like, oh, well, as you get older, things just happen, and so I'm like, I feel like I don't have perfect teeth, and he's like, dude, that's fine, we're good. He's like, that's why we're here for. We're here to help you. We're here to make you feel good about your smile, and that raised my confidence as well. So
For sure. I'm glad to hear that. And I've said this to you before. If you had perfect teeth, you wouldn't need an orthodontist. So
yep,
there's
yep.
that. Okay. Well, we're going to go ahead and say goodbye to you, Bryan, let you get on with your day. Thank you so, so much for joining us. And I
Absolutely.
am sure that I will be talking to you again soon. Thank you,
I'm
Bryan.
honored. Thank you.
All right. Bye bye. All right, guys. So that is what we have for you today. I have dropped a comment in here. If you have any questions for me or for Bryan, we will be following the chat as much as possible. You can always obviously email me, amy@smilesarwild.com. If you have specific questions about your insurance for orthodontics for adults or your kids, or any questions at all about kids, braces, teeth, anything that has to do with anything that we might handle here at PDAO, I am more than happy to personally answer those for you. My email is amy@smilesarwild.com. You can always DM us on Facebook or Instagram. I follow that 24/7. So normally, if you're hearing from someone through a messenger thing, it's normally me. So I am the source. I am the one that answers all those questions. Thank you all so, so much for joining us today, and we'll see you guys again next week. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.